Hi everybody, we're delighted here at Bale to have a visitor from Canada, John Chernesky. John's got 25 years of lived experience and he's the lead of the Rick Hansen Institute and is an expert on integrated knowledge translation. So we're just going to have a bit of a chat about how research can incorporate people with the lived experience of spinal cord injury. So welcome, John.
Thank you, Johnny. So my name is John Chernesky. I am the Consumer Engagement Lead at the Rick Hansen Institute, based out of Vancouver, Canada. And today we're going to talk about consumer engagement and integrated knowledge translation in research in spinal cord injury. So what we're going to do, I'm going to start off running through a few slides that we actually just presented the other day at ISCOS in Sydney, the International Spinal Cord Society's annual meeting. What do they call it? They call it the Congress, I believe is what they refer to it as. So we talked about reinventing the wheel, a paradigm shift in research thinking. For those that were in attendance, they each received a small handout that was created by myself, Dr. Johnny Bork, John Shepard, and Dr. Heather Gainforth. This resource is available through Bale, a digital version or as a print version. I'm sure you'll be widely sharing them, correct, Johnny?
Correct.
Fantastic. So, quick talk. First slide. Too many acronyms. We are referring to IKT and CE in SCI research. Integrated knowledge translation is IKT is integrated knowledge translation. It is the concept of involving persons with lived experience of a health condition throughout the research process, not just as research participants, but as research partners. And consumer engagement as well aims to connect the research community with the SCI community, as well as other stakeholders, clinicians, allied health, and whatnot. Patient-oriented research, patient-centered research. The term I like to use when referring to consumers or patients is persons with lived experience. I recently became aware of the acronym PLEX. I'm not too sure how big of a fan I am of that term, but really when we say persons with lived experience, we're referring to not just the individual living with a health condition such as a spinal cord injury. As we are all well aware, persons that have a spinal cord injury, the spinal cord injury affects not just that individual, it affects their support network around them, their family, their friends, their community organizations such as the New Zealand Spinal Trust. They all have a really important say in what goes on in the spinal cord world. So here's a couple of real clean definitions of IKT. We define IKT as being meaningful engagement of the right research users throughout the SCI research process at the right time. So it's not just about persons with lived experience, it's about the end users. Who is the target audience for your product? If the target audience is the ACC or some other funding organization, you need to involve them. If your target audience is spine surgeons because you're looking to develop a new tool for decompression surgeries, you need to involve the appropriate end users from the beginning. Bringing in all the stakeholders is absolutely key. When we say meaningful engagement, it's not, a tokenistic approach is never going to be successful. If you're going to bring people into the process, you need to bring them in a meaningful way that allows them to contribute and influence a personal or socially meaningful research or dissemination goal and feeling a sense of responsibility to others.
So can I just clarify?
Yeah.
So IKT is all stakeholders. Yes. Whereas consumer engagement is about the person with lived experience, is what that's how you're separating them.
Absolutely. So when we say consumer, again, we're referring to the individual, their family, and the people that love and care for them, and community organizations and advocacy organizations that represent them.
Okay.
And so, yes, with engagement is certainly a bit more narrow. IKT looks at all stakeholders.
Yep.
So why? Why should we do this? Well, it starts with the whole concept of nothing about us without us. It's the belief that those affected by a decision have a right to be part of the decision-making process. And when they are part of that process, their input will influence that decision. I don't know if we need to go into too much detail. I think it's relatively self-explanatory. But why part 2? Consumer engagement. Again, sorry, I'm going to change this slide. I was informed the other day by a fellow researcher that in research, nothing can ever be proven, it can only be disproven. So let's just say that there is evidence to suggest that consumer engagement increases study enrollment rates, it can aid in securing funding, and has been shown to improve study design, protocols, and choice of relevant outcome measures. As well, generally speaking, from our experiences, it also really creates research that has an impact. Really, that's I think what everybody is striving. They don't just want their research to become a publication that collects dust on a shelf. They want it to actually have an impact. And if you're involving the end users, if you're involving the persons living with spinal cord injury, if you're getting the stakeholders involved, when you get through that circle of research, that continuum to the dissemination phase, you don't just end at dissemination, you start to have an impact. You start to see that the research gets utilized and taken up by the target audience. I mentioned earlier tokenism. This is something that I think, for one, it frustrates me quite a bit, but I think a lot of times it's done in a way that's unintended, but it happens anyways. If you seek out a person with lived experience to be a co-applicant on your funding application because the funder requires that you have a patient partner, and you call them up a couple of days before the funding application is due and say, here, just sign your name here and let's get a quick CCCV put up for you, you're doing it wrong. And if that's the only time you speak with them is the funding application, you never consult them on what the research question is going to be or what the protocol is going to be, or in the analysis of the data or assisting in the dissemination, that's tokenism, and it's wrong. Really, the definition there, the practice of making only a perfunctory or symbolic effort to do a particular thing, especially by recruiting a small number of people from an underrepresented group in order to give the appearance of equality within a workforce or a project. Specific to spinal cord injury, we've got the definition that when a person with spinal cord injury or an organization is asked to endorse and therefore legitimize research programs over which they have little real influence or control. What we're striving for is partnerships. We're not striving for endorsement. We're striving for people working together in teams and each contributing their own expertise and background knowledge. So how do we engage? What when I talk about engagement, what are we actually really talking about? This slide here is the International Association on Public Participation's spectrum of engagement. A great tool. This is a great place to start from. It really explains the various levels at which you can involve the public or involve a partner in. None of them, it starts out from sort of the cursory inform, where you're providing knowledge to people without soliciting any sort of feedback, and scales up to the point where you're getting to empower, where you are putting the decision and the final say in the hands of your partner. No one is better than the other. Much like the spectrum of light, no one's going to say that violet is better than red or red is better than violet. At certain points, all of them are very, very useful, and they can be used throughout the research continuum. Different engagement techniques and different levels of engagement can be used. So to give a simple example, when you're defining the research question, you may do that in a collaborative fashion, but sometimes I've found that providing the empowerment to the individual with spinal cord injury is useful. That's what we call patient-centered research or patient-driven research, where an individual talks to a researcher and says, hey, I'm dealing with this particular problem. I've tried doing this. It worked really, really well, but I don't know, does this work as well for other people? Was it just a one-off? And the researcher will say, that's a great question. We should explore that a bit more. We should formulate a research question around your experience. Perfect example, I was using a vibration platform and found that it really had a very positive effect on my spasticity. I had signed up for a research study to be a part of it, but I found that the question that the researcher had been asking and the outcome measures they were looking at and the methodology they were using wasn't really optimal for the intervention. And so we had a bit of a conversation, and this particular researcher said, that's fantastic, dude. I like where this is going. Let's develop a question. And so that really was a patient-driven question. Then at that point in time in my sort of life, I was not as well versed in research methods as I perhaps am now. And so I was involved in the development of the funding application and the development of the methods. But again, I didn't really have a huge influence on it because I'm not that knowledgeable to really dictate what those were. That's where the expertise of the researchers really came in, to understand what outcome measures could be used, what methods could be used to really come to a conclusive answer on that particular question. When it came to the actual data collection, I worked 9 to 5. I didn't have time to be in there with the participants collecting the data, but the research team kept me informed that things were ongoing, how the recruitment was going, what stage the various participants were at. And then when it came to writing the actual publication, we collaborated on that. I was, strongly involved in that. So again, that's just a small example of, through the research continuum, how different types of engagement can work at different points. So one of the things that researchers always ask me about is what tools, what methods can I utilize in my day-to-day research activities. It's enough to say that this is a good idea, but I need some guidance. I need to understand which tools I can utilize to do these sort of actions. So this here, actually, I might put it on full screen. That'll probably work better. There you go. This is a tool developed by the Georgian Fayet Center for Healthcare Innovation. And again, if you look at this, you want to call it sort of branching of options, this is looking at the entire research continuum, from identifying and prioritizing through research design, grant proposal, preparation for execution, data collection, data analysis, all the way down through implementation and evaluation. We'll go through this particular tool a little bit more in depth later on, but suffice it to say, if you're looking at ways to engage at any point along the continuum, you can click on, so in this example, we clicked on research design, and now it branches out into 3 different levels. Do you want to do this at a consult level, at a collaborate level, or at a patient-directed level? You click on any of those 3 options. In this one, we clicked on collaborate. It then opens up into 4 particular options of methods that you could utilize to collaborate or to collaborate with a partner. So in this instance, it talks about charrettes, study circles, participatory design, or patient journey mapping. In this instance, we clicked on participatory design. And if you click on participatory design, it will take you to a secondary page that gives a full description of what participatory design is and explains how it can be used, and really gives you sort of step-by-step instructions on how you can adopt that into your work. We'll go, as I said, we'll go into a bit more depth. We'll go through the actual web page and show you that tool in real time, how it actually works. This is another similar one that we'll go through. This is the Engage 2020 Action Catalog. So again, you've got sort of a matrix of various engagement tools that you can utilize, and then some tick boxes you can select to specify exactly what sort of activity you're looking to undertake, and it'll expand the ones that are most likely to be useful to you. So if you were to click on research activity at a collaborating level, looking in a regional way, you can see, I'll just bounce back again, how the matrix of options shifts, and the ones that are more likely to benefit you are expanded. The ones that are least likely to benefit you have shrunken down in size. And if you go a little further, we talk about engaging policymakers, researchers, and consumers with a bit of subject matter expertise, not a lot of IT skills, but you're probably going to look to have somebody facilitating this this engagement activity, you can see that now a few elements have really jumped out. The one that I have used in the past that works really well is the World Cafe model. So if you click on World Cafe in the screen, it then takes you to, again, a full description of what a World Cafe is, including its history and a bunch of various resources and methods for actually undertaking this engagement activity. So again, we'll go into a little bit more detail about these tools later on. We'll work through them a bit more. But a couple of really easy tools that you can access in your day-to-day work that can come into use and make your life easier. So again, earlier we mentioned this little postcard that we've created. Around the outside, it shows the continuum of research from the question through to methods and dissemination. And in the center, there's a few different suggestions that you can utilize in your work. This is something that if you get a copy of this from the Burwood Academy of Independent Living, you can keep it up on your wall and reference it whenever you need. On the back, there are a list of sort of recommendations on various things that you can do to make your engagement activities more meaningful, as well as a list of various resources, including the two that we just walked through, and some contact details for the authors. Where was I going to go? Sorry, I had a thought in mind. I lost it.
It'll come back.
It'll come back. Anyways, so right now I'm just going to walk you around this circle real quickly. It'll make a lot more sense to you if you've got the paper in hand. But again, so at the development of the research question, collaborate to develop and refine a question that matters to people with spinal cord injury. And again, I think that's the key, is something that matters. If you want your research to have an impact, if you want people to be interested in participating in your study, it needs to be answering a question that actually matters to people. If you're having trouble reaching out to people, you don't know where to find people, reaching out to community organizations like the New Zealand Spinal Trust, they have a huge membership. They know their membership, they know what sort of things that they're going to be interested in, and they can connect you with individuals who might make good partners. In the funding application, we put the term involved. Often persons with spinal cord injury or lived experience are not experts at developing funding applications. So getting them involved, again, maybe this is a skill that they want to develop. You could bring them in more of a collaborative method to sort of build up their skill levels. But again, up to you the way you go about it. Developing methods, conducting research, analyzing data, and disseminating that data. And really the last stage is that impact. If you're working with people with spinal cord injury throughout the process, they're going to feel a real sense of ownership of the work that you're creating, and they're going to want to see it succeed just as much as you are. Often in research projects that have had really meaningful engagement or integrated knowledge translation throughout, by the time you actually get to the dissemination, you've already got an army of people that are behind you, that are supporting you, that are utilizing the networks to share it, that are prepared to advocate to the regulatory bodies or the funding agencies or the insurers, the payers, to get this adopted and into practice. So if you're looking to create research that really has an impact, utilizing some of these techniques can get people on your side to help push through. And right at the center of the wheel, engage early, engage often. If you contact a community organization at the time of publication and say, look at this amazing work that I've done, I want you to share this with everybody, probably going to get a lukewarm reception at best, because they don't feel a sense of ownership. They don't feel like they've been consulted in this process. They don't feel like they've been involved in this process. The earlier you can involve people with lived experience, the better. And again, it creates that sense of ownership, or that sense of belonging to the project, and wants them to get involved. And again, continuing to update people. They may not feel that they need to be involved in every stage of the process, but at least informing them, keeping them updated how things are going. When you're waiting to hear a response from the funding agency or whether your actual project get funded, keep informing them, keep them in the loop, keep them aware of what's happening. Again, people that are informed want to be involved. So this is sort of our lists of do's and don'ts. Right now, there are currently no real best practices that have been established for integrated knowledge translation and consumer engagement. We are working on developing guiding principles, which would provide those validated tools for you. Right now, these are simply the recommendations of people who have done this work quite extensively and are very familiar with it. So you can use these as certainly guiding ideas that you can follow. Engage broadly. If you've met one person with spinal cord injury, you've met one person with spinal cord injury. There are a small handful of individuals with spinal cord injury that I know around the world who really do have the skill set and the expertise to make a strong, meaningful impact on research projects. The problem is there's only a handful of them. And they get asked over and over and over again to be part of projects, and they're more than happy to be involved in your project if it's something that's relevant to them. But we need to get more people involved. So reaching out and getting more people involved. I can't speak to what Johnny's experience is, and Johnny can just as unlikely speak to my experience. So getting a large perspective, you wouldn't expect one physiotherapist to represent all physiotherapists. You wouldn't expect one neurosurgeon to represent all neurosurgeons. You would consult multiple of them, and it's the same thing when you're looking to lived experience. Again, avoid tokenism. Meaningfully involve people with lived experience throughout the entire research process, and the more you can do that, the more benefit it'll have for everyone. Set clear expectations. So establish rules of engagement early on and revisit them regularly. Make sure that everyone on the team, and I mean that everyone on the team, recognizes what their role is, what is expected of them, and that they will have a clear understanding of where their expertise can have the biggest influence throughout the project, and what influence that they can provide and what expertise they can share. Be aware of power dynamics. This is a big one. When you've got somebody who is a spine surgeon in the room, who's got obviously a fairly substantial salary and a boatload of education and a bunch of letters after their name, potentially there's an inequity to an individual who's simply an individual living with spinal cord injury. But at the same time, that spine surgeon might have been practicing surgery in spinal cord for the last 12 years, and that individual with spinal cord might have been living 24 hours a day, 7 days a week with spinal cord injury for 35 years. Who's more of an expert? Whose expertise is more valuable? I'd argue that neither are. I think they're both valuable. And so you need to be aware of those power dynamics, make sure that people recognize that everyone's expertise has value. And that leads very nicely into the next point. Treat everyone fairly. Compensate everyone for their time, their travel, their expertise, and their efforts. Too frequently, I'm in a room where everybody in the room is there as a part of their career, as a part of their salaried position, and the person with lived experience is asked to come in and participate and bring their knowledge and their expertise, yet there's no compensation for their time nor efforts. That's inequitable. That's not right. That's not the way it should be done. If you budget for your engagement activities, funders will allow for it, at least in the Canadian, American, and British models. I can't speak to the New Zealand models, but I would imagine that they would probably feel the same way, that engagement activities and compensation and remuneration for that expertise needs to be considered and budgeted for appropriately. Oftentimes I hear researchers concerned that if they budget for it, it may make their application less attractive. In fact, it's quite the opposite. From my conversation with funders, appropriate budgeting for engagement activities shows that you've thought through the activities that you're going to undertake, that you've considered the costs that those will incur, and that you're prepared to compensate your partners for their efforts and the works that they're doing. recognize experience. People who live with SCI are experts with living at SCI, and their knowledge needs to be honored, explored, and integrated. I think that speaks to everything we've said thus far. Building capacity. This is another one. This is something that I myself and my organization is working towards, and it'd be great to see the work that Bale's doing in building capacity. Supporting people with spinal cord injury to gain the necessary knowledge, opportunities, and skills to be meaningfully engaged in the research process. You can't just randomly grab an individual off the street and say you're going to make a meaningful contribution. Sometimes skill development is required. And again, you know, maybe the first time they're a partner in a project, they may not have a whole bunch of skills, but they do have that experience and that expertise. The more times that somebody becomes involved, the more experience they become at research, and they start to understand the constraints and the methods that are used in research, and they start to understand it better, and it benefits everybody. And remember that everyone has ownership. If somebody contributes meaningfully to your research project, they are a co-author, and they need to be recognized as such. And it only strengthens your publication. I got an email from the British Medical Journal last year explicitly looking for research projects that had patient partners involved in them because they wanted to publish them. So if you're looking for an opportunity to have a high impact publication, recognizing your patient partners, having a patient partner, and making sure they get recognition as co-authors only strengthens your publication potentials. This is a slide that I've stolen from my good friend Dr. Heather Gainforth from the University of British Columbia, Okanagan, and an ICORD principal investigator. I thought I'd share this with you. Again, her argument is that we're stuck on repeat, and we're really sacrificing impacts. You write the grant, you get your money, you do your research, you publish your results, and you use those results to write a new grant. Where's the impact? Where does it actually have an impact on individuals living with spinal cord injury, or whoever your target audience is, whether it's clinicians or surgeons or device manufacturers or whoever it may be? Making sure that your research has impact, having persons with lived experience or your key stakeholders involved will certainly help to strengthen that. And again, this is the challenge we're all dealing with, the valley of death. From bench to bedside to worldwide. We talked about this, the Rick Hansen Institute hosted a conference in 2016, Praxis 2016, where we really brought together all stakeholders. We brought together funders and regulators and researchers and clinicians and persons with lived experience, and all stakeholders to figure out how do we traverse those valleys of death? How do we get research into clinical practice, into the hands of its users? And again, integrated knowledge translation and bringing persons with lived experience into your research can help you traverse those valleys and get your research to an impactful state. All right, so I think that just about covers my slides.
Can I ask a question about, so you've talked specific, obviously your experiences in spinal cord and consumers with spinal cord, lived experience in spinal cord injury. So do those, the George and Faye Yee Centre for Healthcare Innovation and the Action Catalogue, etc., do they include types of research designs that are suitable for people with communication or cognitive impairments?
I have not explored that, to be honest with you, but I was thinking maybe we'd go into their websites and just sort of walk through them a little bit. Yeah.
Okay, well, let's do that.
All right. Did we have any other? No? All right. So what I'm going to do is I'm going to pop out of this real quickly, and we will switch over to that. Oh, where did I go? There it is. Share screen, and we're going to go to Chrome. There we go. Okay. So, whilst we're here, moving a couple of things away so I can see where I am. Let's take you, this is the International Association for Public Participation. As we talked about earlier, this is their spectrum of public engagement. Again, it shows the 5 various levels that they've identified that you can look to engage people in. If you're really interested in exploring this more, if you go to their website, it's IAP2. This is their Australasian sort of website. They do a lot of trainings. So we took a little look at here, and if you go to it, iap2.org.au, and you click on New Zealand training, in here you can see they've got some courses coming up in Wellington. They've got a few coming up in Christchurch, Auckland. So they are doing training throughout the country. If you're looking to enhance your public engagement skills or your integrated knowledge translation skills, they are a fantastic organization. Here, we'll go quickly to the George and Fahey Center for Healthcare Innovation. These guys are developed as part of the Canadian Institutes of Health Research Strategy for Patient-Oriented Research. And it is a very big mouthful. And they developed this interactive mapping tool. If you just, you can go, it's chimb.ca, and you look in their engagement methods. You click on that. It will take you straight to this page. And you go to their interactive mapping tool. So again, as you walk through, there's a list of various things. So earlier we looked at I believe it was the research design. Let's go into, say, dissemination, right? And so when you get to dissemination, I think that this is certainly an area where you may wish to collaborate. You've got the strength of your community organizations and your consumers. So let's go into collaborate. And here you can do workshops, you can do focused conversations, you can do an advisory group. So I think we'll go to the workshop. Do we need to explain what a workshop is?
I think we understand.
You think you understand it? Well, let's try something else.
But we might have to check that because we might not have understood it.
So within this within this descriptor, it basically just goes through what a workshop is and what it can be useful for. And then in their additional resources, the concept and methodology of interactive workshops or planning a participatory workshop.
So it has the sort of literature that you can use to support.
Absolutely. So let's go into planning a participatory workshop. And on this particular one, it's going to go to an external resource, which I'm not super familiar with, but it will explain to you how to plan a participatory workshop. So again, from back then, 2014. Yeah, and so it goes into what is it? Oh, sorry, it just goes on to the next page. But as you walk through it, each of these resources, sometimes they're internal resources, sometimes they're external resources. Let's try another one. Let's say data collection. In the data collection, maybe you don't have a patient partner who's terribly interested in data collection. You want to reference them. So here, let's go with, let's try advisory group. So again, I'll bring you to the description of what an advisory group is and work through, let's say, working with patients and families advisors, the implementation handbook. You can say that louder, John.
I know, sorry. I was just saying how fantastic is it.
It's everything all in one place. I like
It
that.
is, yeah.
So again, working with patients and family advisors. I don't know who developed this. This is Agency for Healthcare and Research Quality. So again, full descriptors and explanation on tools that you can utilize. We could go on and on through here, but I think you guys get the idea. It's a very user-friendly tool. And now we'll go for a quick little exploration at the Engage 2020 Action Catalog. This can be found at actioncatalog.eu. And you just click on and go to the Action Catalog. It's very easy to utilize. So you go in here and you've got this matrix here of all these various methods and tools that can be utilized. So again, it's not specific to just research. You can do policy formulation or whatever it may be. Let's click on research activity, and suddenly it changes. That's the options available to you.
And it's pretty. So much fun.
I can see what's also great about this, John, is that not only is it informative, but it saves you time. Because you could spend half a day on Google searching for each individual aspect of this yourself.
Or you could spend months researching the literature.
Yeah.
So let's say you want to do something that's, I'm a big fan of collaborations. It's my personal preference, but again, no method or level of engagement is better than the other. I just want to inform that. So let's say we want to do a nice big international trial here. And in this, we're obviously going to inform consumers. We want to get industry involved because we want it to be applied. We want to get policymakers involved because we want to ensure that it's getting utilized. I know this probably include researchers, right? Subject matter expertise. Maybe this is something where you do need a fair amount of skill. Let's go to an intermediate level of skill. We're going to be international, so you need some basic IT skills for connecting internationally. Facilitation skills. No, we're not going to need any facilitation. This is going to be an ongoing project and we're going to learn together. Event organization, some basic skills. You need to at least schedule meetings. Oh, close that up. And project management. Certainly you're going to need them, but for the engagement activity itself, you don't really need project management. These things are specific to that. You can also expand practical considerations and participants if you want to get more in depth. But let's go in. So right now I'm seeing open space technology, World Cafe, knowledge atelier. I've never even heard of that before. But let's explore the open space technology. Let's see what this means. This is something I'm not terribly familiar with, so I'm going to be learning alongside you guys. So now that we've clicked on open space technology, it says that open space technology is a method to organize participation events basically of large and medium scale, although events of 5 to 1,000 or more participants have been reported yet within the OST community. The method is used based on the principles of passion, responsibility, and commitment, bearing in mind the assumption that the most productive way to work is to work on a topic for which one cares, obviously. So then we've got a long description, a variety of rules around it, agenda setting, workshop sessions, follow-up durations, how to recruit, objective and of application of the methods. Really, there's a lot of details. Sorry?
It's like a recipe book, isn't it?
Mm-hmm.
It just gives you the basics for everything.
Exactly. So again, you know, there's a variety of different methods that can be used. You can explore some of the options to find the one that's most beneficial to you or that you're most comfortable in using.
And they've got examples.
Yeah.
Exactly.
That's always good.
You know, and if we go back to where we just were, hopefully all that, nope, we lost it all. So let's go back and redo that. We had a research activity that we were collaborating on internationally with policymakers, researchers, consumers, and industry. We had a moderate level of that. We had a bit of this, no facilitation, and a medium amount of that. Okay, so we had open space. What's this? Consensus conference. That sounds quite similar to what we did at Praxis, doesn't it? And again, you've got your short description of to enrich and expand the debate on a socially controversial topic. A group of citizens, rather than experts and politicians, get together to set the agenda and the basis for assessment within a problem area. Long description, the objectives, results and products of the application. Again, who the engaged actors are and where their role is, geographical scope. So again, it really is like a recipe, a who's who, a variety of experts. Again, you can reference, if you're looking for publications, really it is a one-stop shop for engagement activities.
Very good tool.
And I think that pretty much gets as far as I was planning to go in this little chat.
Well, I think that provides anyone watching this video with a wealth of information and at least directs them to the right places to go. So if you'd like to go to these places and try them out for yourself, so definitely recommend that.
Hold on one second. Did I have, sorry, one sec. Stop share.
Oh, no,
there it is. Yeah.
The interactive.
Sorry, one sec. What am I doing here? I'm creating chaos. So we stop the share. Let me open that up. And let's create the share, and we will share this. So this here is the little handout that I referenced a few times for you guys there. Again, it's just a small little postcard size handout. You can see here, it's about the same size as Johnny's head. And it shows the the research continuum, and then on the back, a series of suggestions, recommendations, and references to the resources we just talked about, as well as a few others, and our contact details. If you're looking for a digital or print version of that, you can certainly contact Dr. Johnny Burke at the Broward Academy of Independent Living.
Hey, John, thank you so much for providing that really informative session. I'm sure people are going to find that a really, really valuable resource for researchers, clinicians, people with the lived experience of spinal cord injury as well. So if you'd like to know more, feel free to email John.
Or Johnny.
Or even contact our colleagues, John Shepherd or Heather Gainsford, who also presented with us. And we really hope you find this an informative tool that you can apply in your work. So thanks very much, and continue to search around the BAIL website for more exciting resources. Bye.